Good evening. I'm very happy to see you all here tonight as we launch our criminal justice system assessment for Benton County. This is a concept that I was very excited about when I was running for office, especially since I had the opportunity to speak to many people in the community about our jail, about the justice system and how it works, and about some of the challenges that people perceive with the system as it currently exists. I think there's a wonderful opportunity ahead of us to be able to have this community dialogue, to better understand how all of the pieces of the justice system fit together and how an individual that comes into contact with the system flows through it, and what opportunities there are for each person to come out of it a better person than when they went in. That is not what typically we think of when we think of our jails or prisons. So I hope that we can have a conversation with the community about using our criminal justice system to improve our safety, improve the lives of people that come into contact with the law enforcement, and to improve the community overall. Our intent is to end 2018 with a data-driven and community-informed report that will include 3 scenarios for what our justice system might look like. And each of those scenarios will include a combination of facilities and programs moving forward. And we will be doing cost-benefit analyses for each of these, put together potential descriptions of what the pathway would be to implementation for each of those alternatives. So we're hoping to have as realistic a path as possible forward. We don't have foregone conclusions, although we know we have facilities needs. We anticipate that there might be some new twists on what we have in our system now in terms of jail and courthouse and programs, diversion programs, perhaps more opportunity for restorative justice, certainly better opportunities for women in the system than they have right now. So there are better opportunities to deal with mental health, perhaps. There are lots of questions we could address. We're approaching this system with a set of core values, one of which is transparency. And in that light, what I want to mention is that we are taping tonight. And the reason that we're doing that is because we want to make sure that people that weren't able to make it tonight, whether because of weather or other engagements, can view this presentation online on our website. We also want to make sure that we capture some of the discussion as well, because we really value your input into this whole process. And we will be using your input tonight to help shape the process as we move forward over the next 12 months. Hopefully not 12 months, the next 10 months. We really do want to wrap this process up by December of 2018. The process, I think I'm already missing slides. I already addressed the purpose. You can see a little bit more there. This is not my slideshow, so I apologize. I'm not in sync with the slides. But the process will be guided by a steering committee, and the steering committee is comprised of both folks that are within the system, the sheriff, Chief Sassaman, various other folks that you'll see on this list here, our District Attorney John Haroldson, and many community members like Defense Attorney Thomas Hill, who's here with us today. And I'd like to ask those of you that are here from the steering committee to stand, please, so that others in the audience can see who you are. These are people that will be helping to provide guidance to the overall process, that will be providing first response to some of the reports and data analyses that come forward from our consulting team at CGL. And they will be another way for you to provide input to this process overall. So thank you very much in advance for your time in helping guide this process. I'd also like to acknowledge in the audience my fellow commissioners Annabelle Jaramillo and Ann Schuster, both of whom are looking forward to getting the results from this process and moving things forward. So, without further ado, I'd like to introduce Karl Becker, the lead consultant with CGL, and he will introduce his team and provide most of the presentation here tonight.
Thank you, Xan. We've got a brief agenda to go over with you tonight. We're going to introduce the project team, talk about some of our project objectives, our approach, the schedule, and have ample time for questions to talk about your views of the project and where you think we might need to go. Project team. We basically have two components. CGL, which is the company I work for, basically will be doing the research that's going to inform the analysis for this project. We're essentially a criminal justice management consulting firm. We do work all across the world, actually, but we're primarily based in the United States. We've worked in all 50 states, many municipalities. We do basically this work. We only do criminal justice. We basically focus on justice system assessments, facility needs, program evaluations, anything that we can do to help jurisdictions improve the operation and performance of their justice systems. So our role in this specific engagement will be program evaluation, looking at how well your programs operate, do they meet their objectives, process mapping, looking how people flow through your system, how cases are processed, how efficient is the system in getting people through the process, through the courts, through the jails, into the community. We'll take a look at where the population of the jail and the probation system and the local justice system is going in the future, looking at local crime trends, demographics, and where your future needs are going to be, not just 5 years, but 10 years, 15 years down the road. So we can forecast what the needs are, not just right now, but where your needs will be in the future. We'll benchmark you against comparable systems, jurisdictions, communities that somewhat resemble you, smaller towns, rural areas, large research universities, and try to get some sense of how your justice system compares with systems in those jurisdictions. We'll do a needs assessment based on essentially what you tell us your objectives are for the system, what you want to achieve in the justice system, and then how your system's actually performing, and looking at the gap between where you want to be and what you're actually achieving. And then we'll do a fiscal analysis, looking at, given where you want to go, what is the likely cost of those programs or those facilities or those changes in process? What can you do to make the system as cost-effective as possible? Managing the engagement will be our partners from Greater Oregon Behavioral Health. I have a couple of our team members here. Cameron Glass will be working on the project, and Paul Benar will also be working on our team. So you'll be seeing their faces as well as mine throughout the process. We have several other people who will be also working on this and will be helping on the effort as well. Ari?
Hi, everybody. How y'all doing? The first thing I want to do is thank you. I want to thank you for taking the time coming here tonight, hearing about this project, getting the details. Do I have an echo? I have this echo vermin voice. So you give me a mic, and the windows start to shatter. Just hold on for 1 minute. I can be all right there. So I want to thank you all for coming. Not only to hear about this, but to talk. Let us know what you're thinking. Hi, my name is Ari Basil-Wagner. I'm the board and center on behavioral health and justice in the Ramirez. Our role in all of Florida is to help organizations, counties, jurisdictions, look at how to protect the first people who have mental illness
I'll go through the objectives. Essentially, we want to start off with understanding what your current justice system looks like, how it's formed, what its objectives are, how it's put together. We want to identify the services that you have in place now to help keep people who don't belong in the justice system out of the justice system. People with behavioral issues, mental health issues, people who have treatment needs that don't belong in jail. We want to use research-based responses and best practices, evidence-based programs to ensure, again, that any treatment programs that you have are going to be as effective as possible and use proven methodologies. We're going to assess system performance, we're going to document system needs, and then, based on that information, prepare a plan, as Xan had indicated, 3 different scenarios which show you options, alternative visions of where this system can go based on different assumptions on where the population is going to go, what your jail population is going to look like, how you utilize programs, and show you what those different scenarios look like and what the likely cost and program impact will be on the community.
I'll try this again. How's this? Backup singer. Our guiding principles, transparency. This is key. You all want to know what's happening with the information that's being collected. How is it being collected? What happens with your input? How many of you have been to a community meeting, given your ideas and left and thought, where's that going? Is it some community meeting vortex? What we thought to do about not replicating that kind of a process is on the webpage, the Benton County webpage. We're going to list a summary of what occurs at the community meetings, the kinds of things that are discussed, and where that information goes. What is done with your ideas and thoughts? So you can go online, look it up, and see what happens from the feedback tonight, and subsequently track what happens at all the meetings. Inclusion, looking at many community meetings. This is the kickoff and the first. So we're doing outreach in a couple different ways. I'll talk about that later, though. Public engagement, respect. And there's a whole list of values I would throw up here. Honesty, integrity, authenticity. And I think respect is a nice overarching one. You live here. I'm coming into your community. If that's not done with a lot of humility and respect, then I should just go. You shouldn't have asked me to do it. So it's key. Open evaluation process. CGL is completely open to having questions about what they're collecting, how they're doing the analyses, what the data says. Ask them. Completely open.
Some more specifics on our approach, how we're going to do this work. We basically have a 4-phase planning process. And key here, and you'll notice each phase is accompanied by a pretty detailed plan for public engagement, so that each stage in the process, we will be reporting back to you what we're coming up with, what our findings are, and you'll have a chance to engage with us and challenge us and ask us questions on how we are arriving at those conclusions. So again, in our first phase, which is what we're in right now, we document current conditions. We look at your data. We talk to the stakeholders. We look at the processes. We visit the facilities. We want to document exactly what you have on the ground now and how it compares with what you want to have. That leads us into the needs assessment. And again, based on where you need to be it in terms of professional standards, the objectives of your local community, legal requirements, we want to identify where your key needs are. Program needs, where you're underserving certain populations, that will be addressed in the needs assessment. And then based on how those needs are identified and our analysis in terms of where we see your population going and where crime is going in the community, we'll develop alternative solutions. Again, at least 3 different scenarios showing different paths you can take in facility development, program implementation, and process design to get you to where you want to be. Based on your assessment and the stakeholders' assessment of those solutions, we'll then draft and submit a report to you all that can be discussed, debated, and form the basis for future actions.
So this is a piece I referred to earlier about the extensive and aggressive inclusion. What we're doing is we're looking at, of course, tonight, the project overview and getting your input on that. There will be different junctures where reports will be done and community meetings will be held to give an update on those findings and get feedback. Then we want to have more of an ongoing community meeting. So what does that look like? A couple different things. We want to hold community forums based on different topics. I don't know what topics. You're going to tell us. At each meeting, at all the input we get from the public, we're going to look at what subjects percolate to the top. Say, this seems important for Benton County. Let's have a community meeting on that topic. It's a bit of an organic process where the community drives it. The other things we'll do to get extensive and inclusive community input is attend meetings, regular meetings that people are already going to. Youth groups, homeless group, NAACP, the college, the university. We will reach out and ask them, we'd like to attend, talk about the assessment, and get your ideas and thoughts of what a Benton County criminal justice system looks like. So a lot of opportunity for input. If you haven't already signed up for being on the announcements and distribution to get those dates, please do so. It'll also be on the webpage. Okay, thank you.
Project Milestones. As again, this is a 4-phase process. Phase 1 will wind up in May approximately, and that will present to you in the community and the stakeholders our documentation of current justice system conditions. Phase 2, the needs assessment, will wrap up by July, leading to development of solutions in August. Final Phase 4 will be completed by December, and as I think you saw on the prior slide, we'll present a draft report in October that will be the subject of extensive review, and then based on that review and the comments, we'll proceed to develop and submit the final report. This is much too hard to read, I realize, but, and this, believe it or not, this is a high-level schedule for the project. It has 20 tasks. Under each of these tasks, there's probably at least 5 or 6 subtasks, but this gives you a sense on how the different steps of the project will unwind through the year. Again, we're very heavy into Phase 1 right now, February through May, and then we proceed on through the year with the other phases. So we've done a lot of planning. We've done these type of projects in a number of jurisdictions, and we think this is a very reasonable schedule. The nice thing about the schedule, it provides ample opportunities for you all to participate and provide the feedback that we really need to ensure that this meets the needs of the community. And with that, I think we're ready for any questions you might have. Yes? Stakeholders, we generally define as people in positions of authority and key justice system agencies or county government. So the sheriff, the police chief, the county commissioners, people who have positions of responsibility in government and in the justice system. Yes,
Actually, I was going to say, for stakeholders, for the community input is a lot broader than what was listed. Many different community groups, people with lived experience would be key for feedback, in addition to the kinds of community groups I mentioned. So stakeholders are really varied. Community members, living in rural areas, and definitely people with lived experience. One of my favorite parts of my job is going into the local jails and talking to people there. Insights are incredible. Yes, ma'am. Thank you. And not everyone on that list could be here tonight, so it's a good thing to review. Thank you for asking.
The steering committee is composed of people that are those primary stakeholders, the folks that are within the system, that also helped us to guide the process of developing our request for proposals and then help us select a contractor, and community members. So we added in community members to represent various different interests in the community and also for overlap with other kinds of community processes. For instance, Helen Cunha, who's here this evening, is on our Mental Health, Addictions and Developmental Diversity Advisory Council. And we have Thomas Hill from the Defense Consortium. We also, as you mentioned, have Allison Davis-White from OSU. So we tried to address key constituencies in the process. We are missing a couple people. We will be adding another person from rural community particularly, and someone who represents the African American community directly or more directly. As we know, no one can represent everyone that is like them. They are going to be speaking for themselves and from their own experience. So what we've tried to do is to look for representative folks from different sub-communities within the county, and one of our primary goals was to find people that have a very collaborative attitude, that were willing to work with us as we move through this process and come out with a set of good options for the community. In this case, yes, I'm referring to the Board of Commissioners, the County Commissioners, and our operations team. And so I'm sorry about that. Thank you for catching that in this case. It's primarily the Board of Commissioners, but with the operations team as well. At this point, we don't have any one person explicitly that's representing that lived experience, but we definitely want to engage with people who are broadly not one person, but as many people to share that with us.
I facilitate the steering committee, and they just met one time. I'm going to come back to the room then on your questions. I just want to address what I think is an underlying piece of where's so-and-so on this list. And the steering committee, first night when they got together, they talked about all the other people they'd like to add, and it got up to 50, 60 names. Facilitating a meeting and getting to any kind of decision with that many folks would be what my daughter used to say, Mom, don't be a what? I was like, a what? A W-O-T, don't be a what? So she was talking in text. I had to go look it up. She was telling me, don't be a waste of time. Make sure you make good use of people's time. So what the steering committee said that night was, instead of trying to blow this up so big, have everybody's name on it, but we don't get anywhere, go out to the communities and talk to those groups. Concentrated and intentional conversations with larger representation than one person can do. So if you know of a group we should be talking to, please put it on that piece of paper. If there's someone not up here that you think whose voices need to be heard, put it on your piece of paper. All right? I want to switch topics here. Got a lot of folks in the room. Are there other questions about this before we get to more directed questions with you all? So you had your hand up in the back of the room, and then I'll come up, Commissioner. Thank you for your patience. Jorge? Just curious about Dr. Ramirez's role in this process as a researcher. Thank you for the question, because I love working with Jorge. So.
I need to be coached on this, right? I'm a program and research analyst with Health. And thanks for the cue, too. Put it here, right? But don't eat it, okay. I serve a variety of analytic functions with Kirby in the Center for Behavioral Health and Justice Integration. I do want to say, for full disclosure, that I'm your neighbor. I'm your neighbor to, let's see, I'm a neighbor to the north. I live in Salem with my two daughters. And I'm a neighbor to the south. I split my time with Oregon Research Institute and do a variety of behavioral health research there. So I'm really here to put those skills and experiences to work. That's the shorter answer. Like Ari said, this is a community-driven process. So you lead the way and tell us how we can address the issues that you need to address with a really stellar team, consulting team that you're trying to put together.
Sure. Yes. What Chris was asking was about how he was acknowledging the fact that some decisions have already implicitly been made because of the fact that we have our project team here up front, and we selected that project team before we started an extensive public engagement process. We put out last March or so a request for qualifications. And that was a document that went out on our website. We put out press materials about it, where we solicited qualifications packages from any organization, company that wanted to potentially bid on the process to address what we were looking for, this criminal justice planning process. At that time, we were calling it a criminal justice master plan, which is really a facilities terminology, but we were looking for a broader assessment. We received 3 responses. We actually had inquiries from additional groups, but we only received 3 sets of responses to our request for qualifications. We invited all 3 of those groups to submit a proposal. Then we went through those proposals at different levels. We involved our internal selection team with those primary stakeholders. We looked at it as commissioners. My fellow commissioners and I each met with each one of those, with the 2 teams that we invited in for interviews. We knocked one team out because it focused solely on facilities and didn't address any of the systems aspects. And then when we, after the interview process and asking to see work products from the groups, we chose CGL. It was a difficult decision. Frankly, personally, I think the way that we put together the process, it had a slant towards facilities, but it wasn't what we really wanted. So we were asking for one thing but wanting another. It was a cumbersome process. But I think we have the best team we possibly can have. We have a fantastic group of people that know the facility side, the program side, and the jail forecasting side, and we have a project management team that brings the behavioral and mental health expertise and an incredible deep knowledge of Oregon and Oregon law and policy and practices. And I think that we are going to have a fantastic opportunity to engage with one another about what we want to see in Benton County and where we want to invest our program and facilities funds for the future.
And just to clarify, CGL is a full-service justice consulting company. We do have a section that does facility development. We have architects who do design, but we also have people who do planning. We have people who look at maintenance issues. My background is operations analysis. I wouldn't know how to develop a facility if you paid me $1 million. That's not in my wheelhouse. I look at program evaluation and operations analysis. Our management consulting practice is where I'm based. So we think that's a strength of the company in that we have different disciplines that can be brought to bear on whatever your issues are. But in this specific engagement, We chose to emphasize our experience in looking at systems evaluations, how different programs interact with facilities to meet a specific community's need. And that is that's how we structured our proposal, and I believe that's why we were ultimately selected. Yes, ma'am.
I would think that the steering committee should include someone from the Homeless Shelter Coalition or Housing First. Alita Haas-Holcomb has always been among those leaders, and I've often heard her speak of the need for a detox facility.
I'm on the Housing Opportunity Action Council, so I deal with that whole group all the time. But I wondered if two things. One, maybe the people on this list could stand up and introduce who they are rather than, you know, just a whole group of people and nobody knows who's who. And the last is the last slide with the timeline. If you look, it's hard to tell, but at that bottom line is public engagement. So it literally runs through the whole timeline.
Do the members of the steering committee want to stand up and introduce themselves?
Hi, I'm Matthew Donahue. I'm a Benton County Circuit Court judge, and I'm been serving on the steering committee through the whole process. So I was one of the folks who reviewed with the county commissioners the request for proposals, and we had the interviews and made the selection. So I've kind of been at it since the inception and will continue to serve on the steering committee throughout the process.
I'm Mitch Anderson. I'm the director of the Benton County Health Department, and I too have been on the committee since the very start, looking at the selection of the contractors. And certainly I'm kind of looking at this in the lens of the health department, looking at health and safety and mental health issues, alcohol and drug issues, and looking at those pieces of this continuum.
I'm director with the Juvenile Department. I've been on this committee. Oh, won't be on the tape. Dang it. I tried. My name is Matt Weatherall. I am the director of the Benton County Juvenile Department. I joined this committee, I believe it was in May. I was also part of the selection process and plan on being involved all the way through.
I'm Becky Pape. I'm the CEO of Good Samaritan Regional Medical Center here in Corvallis. I joined also the committee recently, and as Mitch, I bring some aspect of mental health because our organization provides a great deal of mental health, but also physical health. These are a population that we're talking about that have serious chronic illnesses. They show up in our emergency departments, our care homes. We worked collaboratively with jail and police and other law enforcement in caring for these individuals. That's what I bring to this team, and I'm very pleased to be a part of this.
Hi, my name is Helen Cunha, and I'm with Mitch on the MADOC. It takes me a while, it's a long acronym. We are an advisory committee working and trying to understand and deal with mental health problems in Benton County, which include the homeless and also the jail system. And so when Mitch was talking about this assessment, the criminal justice program that was going to start, they wanted a representative. That was one of it, but also some of this is close to my heart. So if I can come up with some positive information and input, I'm hoping that it will be worthwhile. Thank you.
Dave Camille. I'm a circuit court judge. I'm also the drug treatment court judge in Benton County, and I'm currently the presiding judge. I've been part of the process since the beginning, and will continue on.
Good evening. My name is John Haroldson. I'm your district attorney. I am on the steering committee, and I will tell you what my desire is for the not steering committee, but for the process, is to really identify what our community wishes for the best justice system we can have. And that really requires all of us to be informed in the areas that have been identified already. As a public servant, it's critical for us to have a system that reflects the desires of the community. And I believe that this approach will allow us to be able to accomplish that.
My name is Jim Swinyard, a former county employee, and I am representing the Thriving Communities Initiative Council, the 2040 Strategic Planning Group that's been working for over a year now on a new strategic plan for Benton County.
My name is Thomas Hill. I am a defense attorney. I principally am assigned by the court to represent indigent clients and those that are charged with crimes, as well as child welfare cases. My background began many years ago as a young man working in a facility, a large county jail, and moved on into law enforcement following that. And after a number of years in law enforcement, went to law school and found myself prosecuting a short time, and I've been doing defense work for about 20 years. So already, I'd tell you, I've been approached and asked for my input on my observations of the process that we have now. And I've been pleasantly surprised that when I was contacted and asked if I wanted to be part of this committee, that it was not, I was not approached with, we need a facility, what are the issues. It really was taking a step back and looking at the total process, criminal justice process, including, and I have a strong background, if you will, or interest in mental health in conjunction with law enforcement and criminal justice. And again, I was very pleasantly surprised that we're taking a total look, a global look, not just looking to see what do we need as far as a facility. That, of course, is probably part of our look. But again, the process. What do we have available? What do we do with programs and process?
Good evening, folks. I am Joe Kirby, and I am the Benton County Administrator. And the reason that Jim did not want to give the microphone to me is he minimized his contribution to Benton County. For those of you who don't know Jim, he used to be our county sheriff for a term or two. I don't remember how long, term and a half. So thank you, Jim, for your service as our sheriff. Once again, my name is Joe Kirby, and I am responsible for the day-to-day operations of the county. I report directly to the Board of County Commissioners, and I am new to the community. I've been here for 6 months, but I can tell those of you who may be somewhat critical of our process that when I came to interview for the position as far back as April or May of last year, the Board of County Commissioners made it very clear that this would be a project that I would be involved in and working on, and that they underscored that this was not a jail study. This was not a facility study. They underscored that so many times, I think I began to say that in my sleep. So I know that the community has gone through a number of studies in the past over the course of the last 10 years or so. I don't know all the details about those previous studies, but I can tell you that the commissioners have continued to say time and time again that this is a systems view that they wish to take of our criminal justice system, and then they wish to make decisions based on that view. So I just wanted to share that a little bit, because when I was interviewed for the job 9 months, 10 months ago, they were already sharing that view with others, including myself.
Thank you. Thank you for that suggestion, so people could put some more to the faces and the names and who they are and why they're on the steering committee. I'd like to switch this up a little bit, if that's okay with you all. We're here till 8, and then from 8 to 8:30, we'll still be here, so you can talk to us individually. I have some questions that I'd like to ask of you, and we can put those up there to continue the conversation and get some feedback on these items. It still includes other. So after reading this list, if you don't want to talk to us about any of those, you can still go to what's on your mind after hearing this overview, okay? I don't want to limit the conversation. But I am interested in seeing if you see benefits for this study for your community, if you see barriers and suggestions on how we can deal with those. I'd love to hear what questions you want to see asked at those community meetings. How many times at the end of a community input process someone says to me, why didn't you ask? So I'm asking you now. Do you have suggestions for what we should be asking your fellow citizens? I'd love to hear that. And anything else on your mind. So we can think about these questions, think about what else you'd like to share. We don't get to hear from everyone. You can write down responses. I want to remind folks, because I'm also a trauma-informed care trainer, and I'm very sensitive to people's comfort levels with speaking in public and making that a respectful, safe place. So I want to make room for various ideas, thoughts, and feedback without it becoming an arm wrestle. This is a dialogue, a community dialogue. If we can get back to that kind of civic involvement, I'll be so happy. So instead of 50 monologues, we're really taking in what each other has to say and making space for it. We'll do that in a respectful tone. Good for the room? Right on. So now we'll start if you have some answers to these or anything else you want to continue with the conversation. Thank you. Yes, ma'am. Again, the idea of it's being missed on the steering committee, that in your feedback, the process of us going out to the communities, interviewing people in the jails, those who have gotten out, those on the verge of coming in, isn't sufficient in your mind, that it should also be in the steering committee. Am I digesting your comments correctly? Okay, thank you. Yes, sir.
Thank you. So my concern is that at the end, this will end up being a very technocratic, glossy thing with some tables and figures and lots of charts and comparing this data point with that data point. And I'm glad to hear that there's acknowledgement of a broader justice issue to be addressed here. So I wondered if it would be good to upfront address the issues that have been raised nationally as problems with our justice system. For example, people there's more people incarcerated that haven't actually been convicted and have been convicted. There's a harassment of certain minority or poverty-stricken populations. And just sort of address that these have been identified as issues, and then look to the extent that it is or isn't an issue in our own county.
Did you want to talk about what's involved in this? I don't want some glossary report to sit on a shelf and it's useless either, so I'm on your team with that. But your point about, are we looking at what we know are national trends with issues within the correction system and then seeing the extent to which they exist here? Did I get your comment correctly?
Right. And in answer to your question, we are numbers guys. We like to have the data direct us as opposed to making presumptions about what's going on in a community and then fashioning recommendations in that manner. So we do use numbers to get our sense of how the system is operating and what some of the issues are, and the numbers will tell us some of that. But to address your concern, we work in systems across the country. We see the issues that you're talking about, the opioid epidemic, the problem with the mentally ill in the jail systems and the prison systems, the problem of homelessness and how those people end up in the system. So we see common themes, common threads across many of these systems, and we bring that knowledge and that experience with how other jurisdictions are addressing those issues and those problems to the system here. So we try complementary approaches. We are very well aware of what best practices are and what trends are going on around the country, but we inform that with the data on what's actually going on here in Benton County.
So I'm a bit of a data guy myself, but just keep in mind that if the data doesn't exist, there's still issues out there.
Very true, very true.
tag on briefly, we want to mix the quantitative with the qualitative. We're looking at a family of measures, not a single episodic one we're going to pull out of a statistics book. A family of measures, so the pieces of feedback will be incorporated in the analysis along with the hard data.
Wendy Kincaid here. So kind of addressing what barriers do you see? So I was pretty involved with the push to voting to agree to pay for new jail. And I spoke to a lot of people on the ground. And my concern is while I support this assessment, I believe that there's going to be a lot of people who still believe that this is simply a process so that the commission, so that the county can justify the facility that they wanted, and that the barrier being you're going to go through this whole process, come up with some recommendations, and voters are still not going to approve it. And as far as ideas for addressing those, if any of us knew the answer to that question, we'd probably be way ahead of ourselves. But I do have some concerns about this being being called the first meeting, when in fact it appears that everything has already been formed. I mean, the decision to actually do the assessment has been made, so there's no public input about should we have an assessment, and then of course who those folks are. And I think that the concept of transparency didn't happen it's like it starts now, and all of those things are going to put a lot of people unable to support whatever conclusions come out of this. So again, I don't have any ideas for addressing that, but that's what I see as a major barrier.
I want to speak. I think you're right on. And I don't have the magic wand words to minimize that concern and critique. I wouldn't even have it in me to suggest people shouldn't have a cocked eyebrow. But I hope that cocked eyebrow stays with a bit of an open mind to see the process. So go online and look and see what we're doing with the information, to see the outcome and how all the feedback and data is integrated into a full systems review, which I do not believe you've had before. And see then with that process, does that change the mind? My words won't, our actions will. And I take that very seriously. But what's more important is that you all have access to that so you can gauge for yourself.
People may not engage simply because they feel that the decisions are already being made.
Concern for this very involved and inclusive community process, people might not even show to give their input is the idea of the barrier. Okay, that's going to turn my brain in a different way. And I can't do that in 2 seconds, but I'm going to take that in and think about that, what we could do differently with the outreach and what we're doing. What would bring someone with that level of skepticism and concern to a meeting to talk to me about that? Because I'd love to talk with them. But how to get there. Thank you. I'm going to start turning it now. Jorge, I know you've done a lot of work with community engagement and different groups of people. We have some other comments, but I'd like to hear if you have any thoughts on that too, because I know you've worked in. I'm going to skip over here to this gentleman who's waiting and come back up. Is that okay? Did you want to tag on to this question, sir? Okay.
Hi, I'm Gerry Booth, and to answer, I mean, I think you can look back and identify who the leaders of the opposition were, in the past experiences, and not just invite them, but actually go out and recruit them to to become part of the process. Get them on the inside.
Yes, sir. It was good while it lasted.
My question really comes out of what has occurred in Florida, the tragedy in Florida. And how are we going to incorporate schools, K-12 schools, and youth mental health concerns and problems into this study? Because that doesn't seem to be incorporated at this point in terms of your stakeholders.
You're right. Yeah, hold on for a minute, sir. Question, and I have to give a moment to what's happened there and the people who are in that mass in my thoughts.
That's a really important point, but we had to draw the lines around the study somewhere. And we do have our juvenile director, Matt Wetherill, in the group, and our health department director, Mitch Anderson. They both understand what those parts of our system. And Commissioner Schuster's been very active in the youth mental health arena. So it's in our minds, it's in our hearts, but it's not a part of the focal work in this assessment, other than in the sense that we really are hoping to look upstream to those social determinants of what takes people into contact with the justice system to see just how far we can go with our system in alleviating some of those societal stresses and pressures that lead people to trouble.
I just wanted to mention that I was happy to hear it's going to be qualitative and quantitative data gathered. I'm also interested in how the data will be disaggregated as far as groups or groups that are underserved. The benefits, I believe, is going to be that it's an opportunity for community members to become educated or to clarify what they believe is true of complex systems or to speak about them. And my other point is that I think one of the barriers is going to be how will you engage community members that are English language learners, and are interpreters going to be provided so that they can engage?
A variety of comments on all of these. Thank you for your thoughts on what would be helpful, and in terms of de-aggregating the information so it's completely de-identified. I want to turn to Karl for that. I do want to come back to Dr. Ramirez with the point of community engagement. I think I covered, did I miss any of those pieces that you brought up? Did I track them okay? Good, thank you.
The simple answer on how we disaggregate the data really depends upon the level, detail, and sophistication of the data systems you have here. We can only go so far as the information you have available to us to analyze and take a look at. You may have very, very good data, in which case we can do deep dives into the demographics, the backgrounds of the people coming through the justice system, the recidivism rates, factors that may lead to recidivism. But if the data is not there, we're limited in what we can do. So we're just in the very early stages right now. We hope to get a very good sense in the next few weeks in terms of the level of analysis we'll be able to apply to this project.
So back to the issue, complex issue of involving the community. There are models, of course, national, international models, and they're in the realm of community-based participatory processes. We can call them community-based participatory decision-making, research, evaluation, but the key is community-based participatory. And there's guidelines, there's best practices. And I think that the community needs to own this and see what those elements are and are they here. And there are ways for you to examine what process you're having. And from what I hear right now in this very few minutes of meeting you, you're already raising the questions, the key questions, who's represented, whose voices are represented to what degree. And the process that has been set up here is for questions and groups to be identified by you. Ari didn't come here with a predefined list, so we're going to talk to this group of people, and we're here to inform you. We're here to listen and hear what you have to say and lead the process.
I think the only thing I'd want to tag on, and then I'm going to run quickly out here because I see more folks, to the juvenile comment, is I don't want to close the door. I know this study is set up for a specific reason on the adult population, and you also have juveniles who are getting ready to graduate the juvenile justice system where the system wasn't successful. They're 86% successful overall, by the way. But for that smaller group who continue to act out, commit more crimes, and have multiple issues going on about to graduate, we may want to include, if you all are interested, a preventative view on that. Not just wait to find them in the adult. Is there something you can do as a buffer? I know from research you can. Is a community interested in that? So a bunch of hands. Thank you for waiting for that comment. Carol? Yes, sir.
This may sound a little bit like a pep rally comment, but it comes from the heart. And that is to say that our community has tremendous assets in terms of the various perspectives and experiences that people bring to the table. To have a process that allows us to be able to tap into that resource is probably one of our greatest blessings. My concern is that sometimes when we have labels that we use, when we talk about assessments, that can come across as though maybe, oh, this is kind of a process which is predetermined and so forth. And I would submit that at the end of the day, it really boils down to ensuring that as many people as possible are informed. And of course, being informed isn't just my point of view, it's everyone sharing their points of view so that we as a community can decide what it is that we wish. My concern in hearing some of the feedback is the challenge of how we can get more people engaged and get over some of those hurdles that may be perceptions that, well, this is already a decided thing. And maybe that's a question for the members of this community to respond to.
Thank you, and thank you for highlighting that challenge again. I've been known to go to the hangouts and most popular places in a town and just start talking to people who weren't invited to some formal meeting. So we have to be creative. It's important to get that feedback. Yes, so, who's waiting there?
Ari, we have about 3 more questions back here, and I know it's 8 o'clock, so.
Okay, thank you. Are folks good? I know we're ending at 8 and then 8:30. Just are you good for another 10 minutes of this? Am I intruding on anyone's time? Okay, thank you.
Okay,
yes,
real
sir.
quick. My name is John Detweiler, and I've been fighting the county for years because they have a tendency to hire PR firms to educate the voter when they need to hire an ops analysis company, and I'm damn glad to see you, sir, thank you, to educate themselves as well as the voters. Now, my attitude is the criminal justice system is a complicated system of queues. Now, I expect to see you do some modeling or hire a subcontractor to do that. And I expect to see, like I say, a flow chart of how it all works. And I expect to see some what-if drills. Now, when I was, one of the jobs I had a couple different times over the years, we didn't call it ops analysis then, it was ops research. But anyway, I'm sure you know what I'm talking about. But anyway, I think this is the best thing that's happened in 15 years. The county commissioners are finally starting to do it right.
We're going to end there. We're done. John, don't leave without making sure we have your phone number, because I want you and Karl to have coffee or whatever you guys do. I want to know what more from you, and we're not going to get it in 2 minutes. That's right. But you initiated something that I'm not going to let stop when you sit down. Go ahead, Carol.
How do you follow that? No, I'm actually speaking for on behalf of several of the nonprofits in the community. I think we're all delighted that we're taking such a holistic approach to the criminal justice system. One piece that I'll be watching with interest is how we engage and get the perspective of one facet that's impacted by the justice system, which is the victim of crime and the survivor of crime. So I'll be looking forward to hear more about, and not necessarily tonight, but as we go through the process, how we get that perspective as well, because it is also meaningful and important.
Thank you. Thank you. Critical. Yes, sir.
Hi, Chris Lent here again. So I guess the question I have, it's kind of a thought, it's also maybe a concern and maybe a barrier, I'm not sure. It has to do with the kind of reality of the incarcerated population in the U.S. We know that the incarcerated population is not as a result or a direct function of crime rates, but actually about policy and laws in a given community in the country with mandatory minimum sentencing. So when we're talking about the kind of holistic scope of the work that you all are going to be addressing and working on, does it have to do, I mean, with the big issue is that a lot of the issues with the jail happen far before the jail is even in question. It's about the laws that are on the books, and it's about the policing that surrounds them. If we're admitting more people and keeping them in longer, which is what our laws are telling us to do, it's no wonder that we have a growing population that's stressing the jails and the prisons. So is part of your analysis going to include policy?
And the short answer there is yes, absolutely. Policy, enforcement, demographics, all these are factors which basically produce the inputs into your justice system, the people coming in. So we need to understand all those forces. Just knowing how a justice system operates is insufficient. You need to take into account the policies and the goals of the system as well. So we're going to definitely take a look at policies, and hopefully what we've done in other jurisdictions is model the impact of different policies. So if you change a given policy on how you treat drug offenders, what impact will that have on the jail population today and possibly 5-10 years down the road? So we'll model different approaches and different policies and show you basically what the impact is in terms of your program demands and your facility needs down the road.
Okay, good. So I won't have to be the last. So I didn't introduce myself last time. I'm Sherry Clough. I wear a couple of hats tonight. I'm a professor at OSU and a philosopher. I'm also a member of the NAACP. So I'm glad that you're going to get someone from the NAACP on the steering committee. I think that's crucial. It might not be surprised that in this town the NAACP is like half white people, but you know, white people got to do their work, so it's good. But it would be good if it was a person of color, of course, from the NAACP. You know that. Okay, so I was really excited. My ears perked up when you talked about restorative justice and that as an option. And I heard, so I heard that briefly, and then I heard stuff about diversion and diversion based primarily to serve folks who are better placed in mental health facilities or drug rehab facilities. Those are two kinds of diversion. But I wonder, and I don't, what kind of question is this? So I didn't see anyone on the steering committee that seemed, at least on the, from their description, had any kind of background in creative kind of problem solving outside the standard kind of, like we got lots of judges, yay you guys, and sheriffs, and woohoo, fantastic. I didn't mean disrespectful. But like creative kind of thinking about restorative justice models. I should say I know nothing about it. I have nothing to contribute, but that's why I'm here to learn.
Yes, so the look at what's in place and what can be in place is not only effective for people with mental illnesses and addictions, that is part of it because 60% of the jail population have co-occurring issues, but also what are evidence-based practices for all offenders so they leave the system with more skills and ability and connectedness to not recidivate, not reoffend. And there's a lot of evidence-based practices that's both creative. Restorative justice is one of it. The risk needs principle is another. We could go on and talking about what 40 years of research is telling us needs to be incorporated. And that's the key piece. The marriage between treatment and corrections. The dating is over.
Either you or Karl can talk about this. Can you talk a little bit about the depth of the analysis and that you're not looking at just the first data point in a sense of it appears the data says we have a lot of check marks on this particular metric item. Can you talk a little bit more about how deep you intend to go to try to look for the root cause so we're addressing truly systemic problems and not just the surface issues?
Let you take that from the data point of view. I know part of the answer is combining the quantitative and qualitative because you have to put the data in context of your community and what's happening to give that full picture. So I know that's a piece of it. Karl, I don't know if you wanted to add more.
One of the things we do is try to develop a good profile of the people in the justice system and take a deep dive into their backgrounds and their characteristics. So if we have an offender who has been in and out of the system 5 times in the last 4 years. Take a look at that population. Where has he fallen through the cracks? What are his or her characteristics? How is the system not providing him potentially the programs that can make a difference in his life? Why is he continuing to fail? Because basically when a person's coming back and back and back on a repeated basis, it's a cost to the system, it's a cost to the society, it's a cost to the person. Something's fallen through the cracks. So we want to find out what those factors are. That's the type of analysis we can do, again, if the data is available.
We'll wrap up one more. Commissioner, of course.
So at the beginning of this process and of many processes that have happened, we need a new jail. If anybody's been in the jail, you know we need a new jail. But what if we turn the conversation, which is what I'm loving, to we don't need a new jail. These are the things we can do instead of a new jail. So I have no preconceived notions about this process.
Neither do I. I think the next generation of corrections talks about, again, that marriage of treatment and corrections. What can you do for successful diversion and for people who need secure confinement because they are those individuals? And you'll hear more of that from the victims group than is represented tonight. What happens with them while they're incarcerated? So they leave and it does not become that revolving door. Key questions that we're looking at. So I'm going to wrap up with a couple things. I don't know, Commissioner, if you wanted to end with anything. A big thank you. Fantastic conversation. My gears are turning, the feedback of where we need to go, and please write your comments down. We've recorded it, but you have others, please write them down. So what we're going to do, as I said earlier, is we're going to summarize this conversation and put it on the webpage and show what happens with your feedback. Key piece in being transparent is what happens. Will we incorporate everything we hear at every community meeting? Not unless I want the commissioners to TP my house. That's just impossible, folks. But if something can't be done, because I can't promise that, that would never happen at 100%. If something can't be done or gets put on a back burner, you have a right to know why. That it was looked at, reviewed, and this outcome. It was incorporated, this is where it's going, or we needed to do this with it. So that will be clear on the follow-up. I think people have an intelligence and understanding that it's just not everything goes into perfect, but it goes to what happens to it. And you deserve to know that. So that's part of our commitment to you. There's another meeting. The set meeting is May 24th, where you'll be presenting the first analysis at an open forum. But we're not waiting that long to meet with the community members. We're setting those up this week and subsequent weeks and to get those scheduled. Again, check the web page or be put on the distribution list so you get a thumbs up or knowing when those are happening. Thank you for your thoughts, your time, your commitment to your community, your ideas, and helping us to make this a different kind of process. Thank you.
I just want to echo Ari's comments. Thank you for showing up tonight. We really look forward to the next few months of dialogue.